My name is Andrea Bates. I'm one of the project managers here at IPRO ESRD Network program. And welcome to the last module, Module 4, of breaking down the 8 dimensions of patient-centered care. So if you've been following along for the past couple months, we've broken the series down into 4 modules, each covering 2 areas or dimensions of patient care at a time. Each module will have 3 main points, sample conversations, and end with some focused resources for each area. So if this is your first time joining, let me just do a quick overview of the development of the 8 dimensions. They came out of Harvard research on behalf of the Pickler Institute. Studies were done on a broad range of patients and healthcare team providers, and they were asked to consider what was the most important aspect of any patient's care. The results were grouped into clusters, or these 8 dimensions of care, which patients and providers indicated would affect their overall experience of care. And every principle that we are discussing can be applied in some way to the ESRD community in creating a patient's life plan. So really quickly, the 8 dimensions are patient preference, coordination of care, information and education, physical comfort, emotional support, family and friends, continuity and transition, and access to care. So we are on our last 2 of this series. As you can tell, physical comfort and access to care. All right, so when we talk about physical comfort, the 3 things to think about or consider are every patient starts with the pre-treatment assessment, where the nurse can establish a safe baseline for how a patient may be feeling. And as we know from there, it kind of can navigate how this patient's treatment will go. Of course, we know during treatment, other adverse occurrences may occur. It also includes providing interventions as needed to alleviate the patient's pain management. And not just thinking of like the physical body, but like the physical environment. So take into consideration the physical environment where the patient is receiving treatment. So cleanliness of a facility, temperature. I'm sure we've all had conversations with patients about the temperature of the facility. So that being said, I'm going to give a sample conversation, and this is a conversation which I'm sure many of you have had with your patients. When the patient says, "It has been really cold in here during my treatment. I have been trying to make myself comfortable, but nothing seems to be working." Sound familiar, right? So the staff may say it's not unusual for patients to feel cold during their treatment. What we can suggest is bringing an extra blanket or gloves to stay warm. So the patient can respond, or maybe they've talked to other patients who have experienced or said the same thing, and they've said those things have helped. But say the patient is sitting underneath a vent, and they're saying, "Well, can I possibly be moved?" And the staff, could say, "Let me talk to my team. Let's take a look at the schedule and see what we can do to make you feel more comfortable." Little point to consider as well, even if it can't work or the schedule can't be adjusted. And these are things that I know all of you know as dialysis social workers and the nurses and facility managers. But I think we can all agree that as long as you go back and look for the solution, or at least try to accommodate the patient, even if it's a negative outcome or it's not what the patient wants, they'll feel a lot better knowing that you went that extra mile to at least see if it could work. All right, and the last dimension, access to care. Thinking about making sure the patient has access to their actual dialysis treatment. Are they able to get there? Does the patient need a transfer because maybe it's too far away from where they are? Say they were in a nursing home and now they're being discharged home and their actual residence is maybe 45 minutes or to an hour away. Like, can they actually get there? Transportation, as we know, is a big thing. And if a patient is removed or discharged from dialysis or hospitalized, right, longer for an extended period of time, are they going to have access to their actual treatment following all of that? Looking for some flexibility within scheduling. This can be a tricky one. And patients, there's a lot of complexities when it comes to scheduling, as you all know. But patients may not understand that. They can look in the facility and say, well, there's all these empty chairs, so why can't I just move my chair or switch my time? Well, they don't know, like, they're set up in pods and we have a certain ratio tech to patients. They also could be staffing issues, as we've all come up against, but looking for some flexibility and seeing if the patient can be accommodated, and also just looking to follow up with that patient on if it can or not. And lastly, being able to get in touch with various members of the IDD team, regional management, state surveyors, and the ESRD networks. So if patients ask for any of these contact names or numbers, it is very important that you follow through and you give that information to the patient. Sounds very trivial, sounds very common sense, right? However, there have been many times when I have gotten calls from patients or family members where they've asked for the name to the regional vice president or the director of operations for whatever reason, and we're not provided that information. It's also required that you have a grievance poster posted in your lobby that has the contact number to the ESRD networks, as well as the state surveyor information. So if that is something that you are in need of or you don't have, please get in touch with the network and we will make sure that those posters are provided for you. They are available for all 13 states that IPRO covers, as well as they are available in Spanish. So here's our last sample conversation demonstrating access to care. So the staff says to a patient, so we've noticed you tend to skip your treatment on Saturdays. This past month, 2 out of your 3 Saturday treatments were missed. Is there something we can help you with or any other changes the team should know about? And the patient says, well, my daughter was bringing me on Saturdays, but recently her work schedule had changed. My transportation company only operates Monday through Friday. You've all heard of one of those stories, right? How would you feel if we took a look at the schedule and possibly moved you to a Monday, Wednesday, Friday shift? This way, your transportation needs would be covered. And the patient says, I think that would work best, but please keep in mind they only operate between the hours of 8 a.m. and 4 p.m. This is a conversation where I believe many social workers and other staff, but mainly social workers, have been involved with a lot. Patient can only come TTS, say, for the scheduling reasons, but their company only transports Monday through Friday, and as we know, sometimes transportation can be limited. So looking into, can they be moved to a Monday, Wednesday, Friday shift? And yes, sometimes it is really hard because that company, the one that can only transport them, only operates within certain hours. So at least try to fit those patients in that schedule. And if not, look to another alternative, or last resort, transferring the patient to another facility that can maybe accommodate their needs. And lastly, here are some resources to consider. I have the patient rights and responsibilities. there are all different sorts of these resources are available. This one is, we based it off of I believe, the National Kidney Foundation, so it's really comprehensive. There's also a link to the CMS ESRD interpretive guidance for involuntary discharge. Even though this wasn't focused on an involuntary discharge, it does outline the VTAGs associated with patient rights and an involuntary discharge and kind of what the facility responsibilities are. We also have a resource from the National Coordinating Center called A Guide to a Healthier You. And it's just a one pager. Maybe it may be good for someone who's newer to dialysis. Talks about what they need to know on a very basic level about adherence, medication compliance, infection preventions. And then there's a really nice checklist about getting a safe hemodialysis treatment. So it just like kind of helps patients, give them an outline of what to look for a safe dialysis treatment. And that is it. Thank you very much for sticking it through the last and fourth module. This module will be uploaded onto our website as well as our YouTube channel, where all 4 modules will be available with the PowerPoint presentations.